Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your physical health, human dignity, your soul development, and your overall well-being. In this video, I want to talk about blood type diets, or what we also call blood group diet. In other words, are there health benefits of eating according to your blood group? All right. There are four major blood groups types. We have blood group A, B, AB, and O. Then you can also have what we call the resource factor, which can give us resource negative or resource positive. So we can have blood group O positive, O negative, A positive, A negative, B positive, B negative, and then we can have AB positive, AB negative. So you can have another 8 major sets of blood groups. However, when we are talking about blood type diets, the concern is not about whether it is Rh negative or positive. We talk about the major dietary groups. Blood type, that is group A, B, and O. All right. Now, there are patients that can walk into the consulting room. They want to do their blood group. They want to know their blood type. When you ask them why, they tell you that they want to use the results to plan their diet. Okay. Now, it means that these things are happening not just among people that come to the health facility. It means that people can just walk to private labs wanting to know their blood groups for the sake of planning their diets. Okay. So there's nothing wrong with know your blood group, but a doctor will usually do want you to do your a blood group test because of issues of blood transfusion. You have to receive blood, you have to give blood, the bloods must match, okay? And also because when a woman is pregnant, we want to know the blood group of the woman. If it is resource negative, the husband or the partner is resource positive. The fetus can be resource positive. That is a mismatch between the mother's blood and then the mother's resource negative blood, and the fetus is resource positive blood. Now, in subsequent pregnancies, like a second pregnancy, there can be some reaction between the mother's blood and the fetus blood that can cause some hemolysis in the fetus blood. Okay. However, there are injections that can be given during pregnancy to stop this kind of hemolysis from happening. So if you're married, your partner, your wife is resource negative, you are positive as a man, there's no cause for worry because during pregnancy, can give you some injection to prevent this complication that I spoke about. But the point I want to make here is that we doctors or health practitioners talk about blood types when it has to do with compatibility issues. In other words, the blood types must match when it comes to immune transfusion and also to plan a healthy pregnancy. Okay, you are not going to go to the hospital and the doctor will say, I want to know your blood group. And then when you ask why, he will tell you that so that I can help you plan your diet. Okay, that is not going to be something that you are going to be seeing. All right, I'm not sure anybody has experienced that so far. This concept of blood type diet was popularized by one alternative medical practitioner called Dr. Peter D. Adamo. He was a naturopathic doctor who published a book entitled the book Eat Right for Your Type. That was in 1996 and suggested that because of your blood group, you cannot eat certain foods. And because of your blood groups, you have to eat certain food. Now, since then, there have been a lot of controversies around this issue. Several researches have come up to disprove or to debunk this theory or these concepts, okay? Now, what was found out during these researches that were done was that the recommendations that were made for people with their blood, with their blood groups, were just, they mimic the recommendations that would have been made for a general population in terms of eating healthy. Okay, so the blood type diets included for some blood groups plant-based diet. So they're asked to eat fruits and vegetables, avoid more and avoid meat. Okay, they were asked to exercise in addition. So this kind of recommendations are recommendations you make to people for them to stay healthy and to live healthy. There were people that black groups that their dietary regimen were just like the vegetarian diet or the vegan diet, which is common knowledge that vegetarian diet, vegan diet, eating plant-based products over animal-based products, um, it's more of choosing a healthy option in eating. Okay, so they realized that any improvement seen as a result of the blood type diet was not because they were eating according to the blood group, but because if you take, let's say, a healthy diet regimen, like the Mediterranean diet, for instance, you are asked to eat more plant-based products, eat more whole grain, nuts, legumes, cereals, and then when it comes to animal products, eat more fish, eat more seafoods, and lean meats like chicken compared to red meats like goats and beef. When it comes to sweets like ice cream, chocolates, take them occasionally. When you follow this kind of dietary regimen, it doesn't matter what kind of blood type you are going to be said to be eating healthy. Okay. Now, the other problem is that, which I have experienced personally with patients, is that some patients have been asked to stop eating their favorite foods. Imagine that you live in a geographical area and then your options of food are not too many. There are people who can, their local dishes, we don't have a lot of options. So they can eat about the same kind of food every day, maybe two or three times every day. All right. And with a blood type diet, they can tell them to stop taking some types of foods, including some components of those foods. And I've met people who have stopped eating their favorite foods because of the the the, the thinking that they must stop, all right, eating certain foods. And this have not been based on any sound evidence or proof. Okay. So right after watching this video and subscribing to this channel and sharing this video, if you have stopped eating your favorite food, you can start eating it now. All right. Thank you very much for watching this video, and also subscribe to the channel. Thank you.